When the sun rises in Busia and Siaya, it brings in fresh memories of the past. Families have lost loved ones. At the end of 2009, 33.3 million people were living with HIV. That same year, some 2.6 million people became newly infected, and 1.8 million died of AIDS, including 260,000 children. Of all people living with HIV, 68% are in sub-Saharan Africa, where there are an estimated 10.6 million people needing antiretroviral therapy. In light of this fact, Kenya declared HIV/AIDS a national disaster in 1999. It was time to put heads together and save a dying nation from the cold, untold truth about HIV/AIDS, which is a highly neglected area by many institutions. The Health and Social Services Department of the Kenya Red Cross Society took the challenge of walking the talk in HIV-related cases. It placed a firm target on contributing to Millennium Development Goal 6 to combat HIV/AIDS, malaria, and other diseases. Recent government statistics show that at 15.4%, a figure almost double the national prevalence, Nyanza province had the highest HIV prevalence of any province in Kenya. Western province borders Nyanza and had a prevalence of 5.7%, up from 4.9% in 2003. Risk factors include low rates of male circumcision, multiple concurrent partners, and high rates of herpes simplex virus 2. This virus causes genital herpes, which increases chances of HIV transmission or acquisition. These challenges are compounded by the high level of stigma and discrimination towards people living with HIV. A frequently asked question is, who takes care of the people living with HIV/AIDS, orphans, and vulnerable children? The care of these victims is especially difficult due to the day-to-day deterioration of their health. However, as a result of a 58 million shilling donation from the American Red Cross Society, the Family Health and Home-Based Care Project is being undertaken in Busia and Siaya in Western Kenya region. The main economic activities practiced by people covered by the scope of this project in the area are farming and fishing. However, they face difficulty sustaining them due to the various challenges they face. The Africa region proposed to implement a 3-year comprehensive HIV/AIDS prevention, care and support program in Kenya starting in January 2009. The goals of the project were threefold: to decrease the incidence of HIV, to reduce HIV/AIDS associated morbidity and mortality, and to improve the quality of life of the chronically ill in Siaya and Busia districts of Kenya. The American Red Cross, together with the Kenya Red Cross Society, responded to the needs in the two counties, while at the same time building on the success of current HIV/AIDS activities. The American Red Cross's role in the project was the provision of project funding and technical support, particularly as it relates to HIV/AIDS interventions, monitoring and evaluation, managerial support, as well as finance and compliance oversight. The Kenya Red Cross Society was responsible for the direct implementation of the project in partnership with the Ministry of Education, since some of the implementation components were in schools. It was through this close partnership and adoption of best practices that adequate care could be provided to orphans and other vulnerable children. The project acted as a strong pillar at the community level in HIV prevention, care and support. It also enabled strong relationships to develop with programs run by other partners in the region, working in areas such as the provision of antiretroviral therapy, the prevention of mother-to-child transmission, voluntary counseling and testing services, and sustainable agriculture, which lacks a strong community presence. The main focus for the project, which has been running since January 2009 and comes to an end in July 2012, was to increase the capacity of families and people living with HIV and improve the quality of life of the chronically ill through the provision of home-based care and support. Also aimed to increase the capacity of families and improve the quality of life of orphans and vulnerable children. This program has also resulted in the improvement of HIV/AIDS related knowledge, attitudes, skills, and behaviors of youth in the community. Orphans and other vulnerable children in the community were helped in various ways. Some received material help, some were taken to school, others benefited from full school uniform kits, while others got health attention. The components that were successfully implemented are set to continue so as to become long-term measures and sustainable aspects of the project once it's phased out in July 2012. A key feature of the project that needs more support was the sustainability aspect. To achieve this sustainability, most of the support groups have embraced income-generating activities. For institutions like prisons where the project was implemented, magnet theatre was quite a useful tool. It has been embraced and the inmates have taken up the task of preaching about HIV and how it spreads, especially in such institutions. A key feature of the project that needs more support was the sustainability aspect. To achieve this sustainability, most of the support groups have embraced income-generating activities. For institutions like prisons where the project was implemented, magnet theatre was quite a useful tool. It has been embraced and the inmates have taken up the task of preaching about HIV and how it spreads, especially in such institutions. With a few months to the closure of the project, a key feature of the project that needs more support was the sustainability aspect. To achieve this sustainability, most of the support groups have embraced income-generating activities. For institutions like prisons where the project was implemented, magnet theatre was quite a useful tool. It has been embraced and the inmates have taken up the task of preaching about HIV and how it spreads, especially in such institutions. 520 youth, provided prevention education and stigma reduction training for 6,984 community members, and finally built a capacity of 283 KRCS staff and volunteers. With its achievements so far and its strong volunteer base, it is believed to be amongst the best implemented projects in the recent past. This project is a strong testament to the Kenya Red Cross Society value proposition, always there.